Hi, everybody. Let's start on our discussion of the endocrine system. The endocrine system is an organ system that coordinates other systems within the body in order to maintain homeostasis. Now, the system is comprised of various glands that release chemicals called hormones. These chemicals are released in response to changes within the body. Hormones are released and then circulate through the bloodstream in order to reach target cells. The stimulus to produce these hormones can arise from nervous system impulses, differing levels of circulating hormones, or stimulation of one hormone by the action of another. The target cells have receptor sites that bind to specific hormones and then affect changes within the target cells. Some examples of these changes would be the action of epinephrine as it binds to beta-2 receptors in the lung. Once it binds to those beta-2 receptors, it causes bronchodilation. Another example would be insulin binding to receptor sites in muscle cells, resulting in the transport of glucose into those cells. Now, the number of receptor sites in the body can vary. If cells recognize that they need more of a hormone, more receptor sites can develop in response. Conversely, if there is an abundance of hormonal activity, receptor site production can decrease. Now let's move on to the next slide. Most hormones are controlled by a feedback system that can be either positive or negative. These feedback systems maintain homeostasis by regulating adequate hormone levels in the blood. I think the best way to describe the negative feedback system is to compare it to something we are familiar with in our everyday lives. The negative feedback system works like a thermostat. Cold air activates the thermostat, which sends a signal to the furnace. The furnace turns on, warms the air to the set temperature, and once that air temperature is reached, it then turns off. In a positive feedback system, the target organ acts beyond its normal capacity. The textbook example is that of the effects of oxytocin. During childbirth, pressure from uterine contractions will stimulate the release of even more oxytocin by the posterior pituitary. Once the baby is born, pressure decreases, oxytocin release is diminished. Now let's move on to the next slide. The major structures of the endocrine system are the hypothalamus and the pituitary gland. The hypothalamus can be compared to the thermostat in the previous example. The hypothalamus receives a neuronal, humoral, or hormonal stimulus, then communicates with the pituitary to release hormones until homeostasis is maintained. All right, we're going to move on now. Here is the list of hormones secreted by the anterior pituitary along with their target organs. Let's briefly talk about the first one. We can discuss the rest later. Okay, in the first example, low levels of T3 and T4, thyroid hormones, will stimulate the hypothalamus to secrete thyrotropin releasing hormone, or TRH. TRH then activates thyroid stimulating hormone, and that will result in the production of T3 and T4 by the thyroid gland. When T3 and T4 levels rise to sufficient amounts, then receptors in the hypothalamus will inhibit the release of thyrotropin-releasing hormone. Next, we'll talk about pharmacotherapy as it applies to the endocrine system. Hormonal pharmacotherapy is indicated in a variety of conditions, and these conditions can affect multiple target organs. Hormonal therapy can block actions of other hormones. Common examples would include propylthiouracil, or PTU, which blocks the formation of T3 and T4, thereby reducing the effects of hyperthyroidism. Another example, testosterone can be administered to block estrogen receptors. Breast cancer cells require estrogen to grow, so blocking those receptor sites help to reduce breast cancer cell enlargement. Hormone therapy can also replace chemicals in the body. An example with which you are all familiar is insulin. Insulin is administered subcutaneously when beta cells of the pancreas are unable to produce it on its own. Finally, hormones can exaggerate a response. Steroids, such as glucocorticoids, have an immunosuppressive action. Steroids are given to suppress asthma and to suppress transplant rejection. And now let's move on. And we'll talk about some general assessment questions to ask if you are suspicious of a possible endocrine disorder. First of all, ask about family history. Diabetes, autoimmune disorders tend to have familial predispositions. Ask about changes in weight. Changes in weight can occur with diabetes, thyroid disorders, or even long-term steroid use. Appetite decreases can happen with hypothyroidism. Difficulty swallowing can occur with thyroid enlargement. Skin color changes occur with adrenal disorders. Increased thirst is a sign of both diabetes insipidus or diabetes mellitus. Fatigue can happen with hypothyroidism. Lack of sleep can occur with hyperthyroidism or hypercortisolism. So next, we'll talk about hypothalamic and pituitary medications. And we'll start on hormonal therapy for pituitary imbalances. But first, a couple of words about the hypothalamus. This organ receives signals from the nervous system and then makes adjustments to restore balance. The hypothalamus controls a variety of functions, such as heart rate, temperature, appetite, among other things. Hormones secreted by the hypothalamus have one target organ, and that is the pituitary gland. Releasing hormones from the hypothalamus will stimulate the secretion of pituitary hormones. Inhibiting hormones that are released will decrease the secretion of pituitary hormones. Now, underproduction of pituitary hormones is called hypopituitarism. It can be caused by a number of things, among them surgery, radiation, tumors, or a congenital condition. Treating the underlying condition will sometimes correct the problem. At other times, pharmacotherapy may be another option or the only option. Let's move on to the next slide. And we will talk about somatropin. Somatropin is a growth hormone that is secreted by the anterior pituitary. It has several functions, such as bone and cartilage growth, protein synthesis, and decreasing the use of glucose. When children place on the 1 percentile on the growth chart or have a serum deficiency of growth hormone, somatropin therapy is indicated. Somatropin works by stimulating the growth of long bones in children, thereby resulting in an increase in height. It is possible to grow about 6 inches if given early in life. Somatropin is usually given subcutaneously in very, very precise doses. It is expensive and may cost $30,000 to $40,000 a year. It's generally well tolerated, although there is a slight risk of antibody formation. There is also a risk for hyperglycemia as well, because growth hormone could increase insulin resistance. Glucose levels must be monitored. Another word on somatropin. It should not be given after epiphyseal closure has occurred. During childhood, there's an area of cartilage along the end of long bones. Once maturity is reached, the cartilage ossifies and the bone no longer lengthens. So we don't give somatropin after that point. We'll move on to the next slide. And we'll talk about mecasermin very briefly. This medication is the alternative to somatropin whenever antibodies form. Like somatropin, glucose levels must be monitored because there is a risk for hyperglycemia. Other adverse effects include headache, dizziness, and vomiting. Now let's talk about deficiencies in antidiuretic hormone, which is released by the posterior pituitary gland. A deficiency in antidiuretic hormone causes diabetes insipidus, or DI. DI results in the overproduction of very dilute urine. Although some causes of DI may be due to kidney dysfunction, we will limit our discussion today to the neurogenic causes. And there are multiple possible causes of that, such as head injury, surgery, tumors, or infections. The medication of choice for treating DI is desmopressin. It is a synthetic antidiuretic hormone. Now, unlike the other medications that we'll be studying, the target organ for this medication is not within the endocrine system. It is not the pituitary gland. The target tissue would be the renal tubules of the kidneys, where it increases permeability of water, and that results in fluid retention. The most significant adverse effect of desmopressin is water intoxication. The body holds on to too much water. This condition is characterized by drowsiness, headache, and listlessness. As it progresses, convulsions and coma may occur. Because desmopressin may cause fluid retention, it is contraindicated in patients that have hypertension and renal failure. So we'll move on to the next slide. And we will discuss overproduction of growth hormone and the pharmacotherapy used to treat it. Overproduction of growth hormone in adults is called acromegaly. This condition can result from anterior pituitary tumors. Because epiphyseal closure has occurred in adults, bones don't lengthen, but instead become deformed. These changes can occur over 7 to 20 years, and you can see the progression in these 3 photographs. Now, look at the bones of the hands, face, jaw, and forehead, and notice how they've grown in the sequence of these 3 photographs. In addition, the nose has become broadened. Arthritis may develop. The tongue might enlarge, and speech becomes difficult. Treatment for acromegaly would involve tumor removal and administration of the medication known as sandostatin. Sandostatin is a growth hormone antagonist. Because it blocks gastric enzymes as well, it is often used for severe diarrhea. Not coincidentally, most of the adverse effects are related to the digestive system. Nausea, vomiting, diarrhea, abdominal cramping, and elevated liver enzymes can occur. Changes in glucose levels can occur as well. The next topic in our discussion will be thyroid gland function and thyroid gland disorders. The effects of thyroid gland function are far-reaching and impact just about every organ in the body. The thyroid gland affects carbohydrate metabolism, growth of several organ systems listed on the slide, and helps to maintain muscle tone. As mentioned before, low levels of thyroid hormone, namely T3 and T4, will cause the hypothalamus to secrete thyrotropin-releasing hormone, which then causes the release of thyroid-stimulating hormone. Iodine plays a part as well. Iodine, which is trapped in the thyroid gland, binds to a chemical called tyrosine and then forms T3 and T4. These are slightly different in the number of molecules, but have the same effect. Namely, they increase basal metabolic rate. And now we'll move on. And we'll talk about hyperthyroidism. Hyperthyroidism involves an excessive secretion of thyroid hormones. Common causes include Graves' disease, an autoimmune disorder, and carcinomas. Now, Graves' disease, as I just mentioned, is an autoimmune disorder, and it's probably the most common cause. With this condition, autoantibodies form that bind to thyroid gland receptor sites and constantly activate the gland. Diagnosis for this condition is made based on elevated serum levels of T3 and T4, as well as clinical manifestations. If untreated, thyroid storm can occur. This condition can have a mortality rate of 80 to 90%. Manifestations of thyroid storm include high fever, heart failure, tachycardia, agitation, restlessness, and delirium. Now I'm going to play a video on hyperthyroidism on the next slide, and I'd like you to pay close attention to the signs and symptoms. Important point here. The signs and symptoms of hyperthyroidism can also appear if a patient receives too much of the medication that is used to treat hypothyroidism.
Welcome to this video tutorial on hyperthyroidism. Hyperthyroidism refers to the overproduction of thyroid, in which the thyroid gland produces excessive amounts of thyroid hormones, T3 and T4. When the thyroid gland is overactive, it overstimulates metabolism and aggravates the effect of the sympathetic nervous system, causing the body's processes to speed up. The symptoms of hyperthyroidism include the following: nervousness or anxiety, irritability, heart palpitations, hand tremors, excessive sweating and heat intolerance, in which the skin is continuously flushed, warm, soft, and moist. However, elderly patients may report dry skin with itching. Tachycardia or fast heartbeat, atrial fibrillation, and elevated systolic blood pressure. Hyperactivity, insomnia, increased metabolic rate, increased frequency of bowel movements, and weight loss despite increased appetite. Osteoporosis and fracture, fine brittle hair with hair loss, muscle aches and weakness, fatigue, light or infrequent menstrual cycles, and problems with fertility. A goiter or enlarged thyroid gland may also develop. The course of the disease may be mild, or it may progress continuously if untreated, leading to emaciation, intense nervousness, delirium, disorientation, and eventually heart failure. A severe manifestation of hyperthyroidism is called a thyroid storm, usually seen in a patient with Graves' disease. It is a medical emergency manifested by a severe increase in metabolism, usually precipitated by a major stressor, such as infection, trauma, or surgery. It can also occur when a patient is inadequately treated or stops taking prescribed therapy. Signs and symptoms include elevated temperature, increased tachycardia or onset of dysrhythmias, elevated blood pressure, worsening tremors and restlessness, worsening mental status, delirious or psychotic state, or coma. Patients with thyroid storm are managed in a critical care unit, with focused care on lowering their metabolic rate as fast as possible and managing their cardiovascular status and hyperthermia. Remember, hyperthyroidism is an increase in the body's production of thyroid hormones. This causes an increase in metabolism, causing the signs and symptoms that we've discussed today. Thank you for watching this video tutorial on the signs and symptoms of hyperthyroidism, and be sure to subscribe and like us on Facebook.
Propylthiouracil, or PTU, is the prototype for antithyroid agents. PTU prevents tyrosine from binding to iodine, thereby inhibiting the production of T3 and T4. Therapeutic effects may take about 3 weeks, since the medication has no effect on thyroid hormones that have already been produced. I listed most of the adverse effects on the slide. Remember also that high doses of PTU can result in hypothyroidism hypothyroidism. Hypothyroidism can have either congenital causes or can develop in adulthood. Common signs and symptoms include fatigue, slowed speech, depression, sleep disturbances, anemia, and constipation. When the cause is congenital, treatment should be started within the first 6 weeks of life. This helps to prevent a condition called cretinism, which causes mental retardation and growth impairment. Now, what you see in the photograph on the left is a condition called myxedema. This condition is caused by a slowdown of metabolic processes. Manifestations include dull, puffy skin, periorbital edema, a prominent tongue, and a mask-like affect. If untreated, coma could ensue. Be sure to tell your clients that are taking levothyroxine, which is a synthetic synthroid, that replacement is lifelong. And that's our presentation for today. Please feel free to email with any questions or comments, and have a great day.